If you map, if you will, the global supply chain for contraceptives from raw materials to the end user or client, many of the so-called choke points to a reliable supply of contraceptives is in sort of the in-country part of that supply chain. And they have to do with the capacity of countries to, in a timely and efficient way, to procure contraceptives and to distribute them. And just as two examples, with the shifts in development assistance towards basket funding and budget support for health programs, country governments are now looked to assume new responsibilities for the procurement of contraceptives. And this is a good trend. On the other hand, the expectations can get a little bit ahead of the shifts in development financing, where country governments are not quite ready to assume these new responsibilities, and a certain amount of capacity building is necessary. Further downstream, country supply chains are being severely challenged now by other trends. For example, integration of supply systems, where countries are moving from having wholly separate vertical supply systems for family planning on the one hand, for HIV on the other hand, and for malaria and for so forth, moving from that towards a more integrated supply system. However, no one of those vertical systems is really prepared to expand and take on the responsibilities of distributing all of these other supplies as well. So they're being severely challenged now by that. Decentralization is another trend that's challenging supply systems, where the decisions for supply management are now being made or expected to be made at lower levels in a country, when again they have not had the experience in doing that, and a certain amount of capacity building is needed to prepare them to assume those new responsibilities. If a program manager is confronted with a stockout, I think one of the very first things they need to do is, if you will, to call someone. And whether it's the district manager or whoever is up above them, and say, hey, I have a problem, I am stocked out of a particular contraceptive method. I think sometimes there's not that action, and people feel, well, my next delivery is a month from now, so I just wait for that month, and in the meantime a particular method may not be available at their clinic or other facility. So it's really important that a system has a way, whether it's a hotline or other ways, for managers to raise the alert, if you will, to set off the fire alarm and to say, I have a problem. But beyond that, it's really important then, once that sort of fire is put out, if you will, and the stockout is addressed, it's really important to look at, why did this happen? Clearly there's been some kind of, if you will, system or maybe even a human failure. And it's really important to identify that, and to, whether it's training or other measures, look at how this fire again, or stockout, can be avoided in the future. I think again that program managers, particularly at a higher level, can advocate for and raise awareness of the necessity of a reliable supply of contraceptives, inasmuch as it is a public health priority and addresses a country's health and larger development needs. They can advocate specifically for particular supply chain improvements that are necessary to make supply chains work better. They can provide the necessary information for informed budgeting. I think also at lower levels, if we're talking, for example, about clinic managers, they can wear awareness to their supervisors about the impacts of the lack of a reliable supply on their clients, and what is the impact of this on their lives. And I think that the more that people all up and down the supply chain, if you will, are talking about this and raising awareness of the consequences they see of lack of a reliable supply, we hope the more the message will be heard higher up, so that the key decision makers do take it upon themselves to make this a priority and make the necessary investments.